Hi everyone, thank you so much for watching this video. My name is Eva and I'm going to be talking about my dissertation, which explores counseling interventions for children of incarcerated parents. So in the literature, parental incarceration refers to the imprisonment of a child's parent or caregiver. It's a complex and often hidden issue with profound consequences for all children involved. Globally, it affects millions of children, although the true number is difficult to determine because of the inconsistent data collection. In the UK alone, nearly 200,000 children were estimated to have experienced parental imprisonment between October 2021 and October 2022. So when a parent is incarcerated, it doesn't just result in a physical separation. It can trigger a cascade of emotional, psychological, and social challenges for the child. These challenges can include disrupted attachment, trauma, economic instability, stigma, and reduced access to consistent care and support. These effects can be long-lasting and are often overlooked in both policy and practice. Children with incarcerated parents are more likely to display antisocial behavior and experience disrupted living arrangements, including placement with extended family, acquaintances, or within the foster care system. These children are also at increased risk of school exclusion, particularly in the context of high parental conflict. Even at a young age, elevated levels of antisocial behavior have been observed, particularly among children who have experienced paternal imprisonment. They are more likely to be absent for extended periods, underperform academically, and have lower rates of high school graduation compared to their peers. So without appropriate support, children affected by parental incarceration are at a greater risk of adverse outcomes, including mental health difficulties, poor academic achievement, and involvement with the criminal justice system themselves. Research also highlights increased vulnerability to substance misuse, behavioral problems, and social exclusion. The cumulative effects of these risks can significantly impair a child's development and well-being, potentially perpetuating cycles of disadvantage and incarceration across generations. So therefore, the absence of targeted interventions and support structures not only affects children, individual children, but can also have a wider societal implication. This issue is something that I care about deeply, not just as a researcher, but as a person. I have always been interested in the criminal justice system, and when I realized I could complete the 30 hours of work-based learning that this course required through voluntary work, I signed up to volunteer with the Prison Advice and Care Trust, which is otherwise known as PACT. In my role with PACT, I supported children visiting their mothers at HMP style. Being there on the ground, seeing how children navigated those visits really opened my eyes to the emotional weight that they carry. I saw children trying to stay strong, trying to make sense of the world and what was happening around them, and often without the language or support to express how they really feel. This experience has had a long-lasting impact on me, and it's made me want to do more than just witness the issue. It made me want to research how I can actually help. So that is why this dissertation exists. I wanted to explore how counselling interventions can support children affected by parental incarceration, not just in theory, but in practice. So because of that, the guiding question of my research is: what counselling interventions have demonstrated the greatest efficacy in improving the psychological well-being of children affected by parental incarceration? So to answer this, I conducted a systematic literature review of studies published between 2015 and 2025. The studies are focusing on the effectiveness of therapeutic approaches aimed at supporting children under the age of 18 with one or more parent in prison. So the methodology This systematic literature review adopted a thematic synthesis approach underpinned by a constructivist theoretical framework. This perspective acknowledges the subjective and contextual nature of children's lived experiences, making it well suited to understanding how counseling interventions are received and experienced. My review followed the PRISMA guidelines. This structured framework provided a clear and consistent process for identifying, screening, and selecting studies, and helped maintain methodological integrity throughout the review. Inclusion criteria were defined using the SPIDER tool, which is outlined here on the slide. The SPIDER tool offered flexibility for incorporating a range of study types. Studies were eligible if they were peer-reviewed, empirical, and focused on children and or adolescents under the age of 18 who had at least one incarcerated parent. The interventions had to include a counseling or therapeutic component aimed at addressing emotional, behavioral, psychological well-being. Studies were excluded if they focused solely on adults, did not include a counseling element, or were non-empirical. A comprehensive search strategy was carried out across 4 databases: PsycInfo, PubMed, Scopus, and ERIC. Search terms included combinations of keywords such as child, parental incarceration, counseling, therapy, intervention, etc. And then I've used Boolean operators to refine the results. All records were managed in Zotero, where duplicates were removed and remaining studies were organized for screening. Titles and abstracts were initially reviewed to assess relevance, followed by full text screening against the eligibility criteria. In total, 15 studies were included in the final review, and the process of that can be seen here in the Prisma flow diagram. To extract key information consistently, a structured data extraction form was used. This captured essential details such as publication year, country, participant demographics, intervention type, etc. Quality assessment was conducted using the appropriate critical appraisal skills program checklist, otherwise known as CASP checklist. These checklists were tailored to each study's methodology. This process evaluated the reliability and validity of the research, identifying potential sources of bias, and informing the interpretation of the findings. One of the most significant challenges in the review was determining what actually qualified as counseling, as the term was used inconsistently across studies. This required careful examination of each of the methodologies to confirm that the support offered was genuinely therapeutic. Additionally, some studies lacked direct measures of child outcomes or clear demographic information. But overall, the PRISMA framework helped maintain a systematic and coherent review process. So as I mentioned, 15 papers were eventually carefully selected to be a part of my dissertation. And using thematic synthesis, the findings from these 15 studies were organized under 3 main themes. So the themes that I have identified were emotional and behavioral outcomes, effectiveness of therapeutic models, and implementation contexts. Most interventions reported positive changes in children's emotional well-being, including reduced anxiety, depression, and emotional dysregulation. Therapies such as trauma-focused cognitive behavioral therapy and child-centered play therapy were especially effective for children aged 4 to 10. And they were really effective in supporting emotional regulation and reducing distress. For adolescents, group-based programs were found to be effective for enhancing coping strategies, emotional expression, and peer relationship. One arts-based intervention also reported increased emotional awareness and trust in children aged 8 to 13. And the behavioral improvements were most notable among boys aged 7 to 11, particularly among the sample group that prior to the intervention presented with aggression or attention difficulties. There was no single universally effective approach. Trauma-informed models such as CBT and TFCBT supported cognitive reframing of distressing experiences, while narrative therapy was beneficial for children ages 6 to 12. For younger children or those less able to engage verbally, person-centered and attachment-based approaches such as play and art therapies proved very effective. Parent-focused interventions showed promise in improving child outcomes indirectly, particularly when aimed at supporting reunification, although results vary depending on contextual factors such as prison conditions and parent-child contact. Where and how an intervention was delivered significantly influenced its success. School-based programs such as the MAC intervention offered routine, low-stigma support and improved emotional well-being and classroom engagement. Community-based, creative and resilience-building interventions were also very effective, particularly when child-led and client and trauma-informed. In contrast, prison-based programs often faced logistical challenges, including staff turnover and institutional restrictions, which can hinder sustained engagement. A notable and consistent theme was the impact of stigma. Children often described shame and secrecy as more distressing than the incarceration itself. Interventions that directly address stigma through methods like group reflection, peer storytelling, or psychoeducation tended to be especially transformative. So, what do these findings mean for real-world counseling practice? This review has shown that there is no single intervention model that works for every child affected by parental incarceration. Instead, what emerged clearly is the need for flexible, developmentally appropriate, and trauma-informed approaches. Interventions were most effective when they matched the child's age and emotional needs, such as play therapy for younger children or group-based counseling for adolescents. Culturally, sensitivity also played a major role in intervention success. In one study from Iran, for example, it was reported that narrative therapy helped children process anxiety and depression, but only because it was adapted in that cultural context. That really highlights how important it is for programs to reflect the specific backgrounds and environments of the children they're designed to support. Schools and communities consistently came through as the most effective setting for delivering counseling. They offer routine access, reduce stigma, and allow children to engage in a familiar, non-threatening environment. Programs like the MAC school-based intervention demonstrated real impact on emotional well-being and classroom engagement. Likewise, creative community programs that encourage peer support and emotional expression often had transformative effects, especially when they focused on strengths and resilience rather than reframing the child solely as a victim. Parenting programs, particularly those preparing incarcerated parents for reunification, showed potential too. However, they often face serious logistical barriers within prison settings. Things like staff shortages, inconsistent attendance, or limited opportunities for parent-child interaction were a huge barrier. And these really limit how much these programs can help in practice, even if the theory behind them is good. Systematic and structural factors like poverty, stigma, and institutional inflexibility continued also to act as a major barrier across multiple studies. Children often describe the shame of having an incarcerated parent as more painful than the separation itself. Interventions that directly address stigma, such as through peer storytelling or group reflection, helped reduce secrecy and build trust. That suggests that the emotional environment we create around children matters just as much as the intervention model we use. It is equally important to recognize the groups that have been overlooked in existing research. Children under the age of 5, those from ethnic minority backgrounds, and children from non-traditional family structures were often underrepresented across the studies reviewed. Even though children are the primary beneficiaries of these interventions, they were rarely involved in shaping them. This represents a significant missed opportunity. Meaningful child participation could transform service design and delivery, and it could enhance relevance, trust, and engagement for the child. For example, children could contribute to decisions about the format and settling. For example, group versus individual counseling. Children could suggest activities that feel safe and engaging, or they can help co create resources that reflect their lived experiences. Such participatory approaches align closely with trauma informed principles by promoting empowerment, voice, and choice. Despite the promising findings, several methodological limitations affect how broadly these results can be applied. Many studies had small sample sizes or were conducted in narrow geographical or institutional context, which limits generalizability. Inconsistencies in outcome measures also made for difficult comparison. Some used validated tools, while others relied on practitioner observation or qualitative accounts. Furthermore, only a few studies included follow-up data, making it unclear whether positive changes were sustained over time. Long-term research is needed to understand how early interventions shape children's development into adolescence and then into adulthood. So, in summary, interventions work best when they are context sensitive, relational, and co produced. As professionals, we need to advocate for support that is inclusive, collaborative, and grounded in children's lived experiences. And going forward, more long term participatory research is essential to make sure that these interventions don't just create short term improvements, but make long lasting and meaningful change. If there is one message I want you to take away, it's this. Children affected by parental incarceration don't just need to be seen, they need to be supported meaningfully and effectively. The psychological challenges that these children face are very real, but they are also very treatable with the right intervention. These findings matter because they show us that what we as counselors actually can do. We can't change the fact that a parent is in prison, but we can help the child feel safe, understood, and connected. We can help them build resilience and reclaim a sense of agency. In real-world counseling, this knowledge can inform better interventions, ones that are inclusive, accessible, and grounded in real children's experiences. With the right approach, we can make a genuine difference in the lives of children who too often go unseen and unsupported. Thank you so much for taking the time to watch this video. I have included some references in this slide and also in this slide if you are interested in reading them. Thank you again.